Hello, and welcome to The Balancing Point. My name is Catherine, and I am here with Dr. John Nieters, who will be talking with us regarding weekly topics for The Balancing Point.
Yeah, thanks, Catherine. So those of you that don't know, Catherine and I have worked together for many years. She's an ardent student of Chinese medicine, but also of functional medicine. I've been teaching functional medicine classes for about 20 years, and so we have very similar passions about this. And we are now recreating a series that I had done for many, many years on the radio. For over 10 years, I had done weekly podcasts, which were call-in shows where people would call in literally about anything. We had Tatiana that would call from Stalingrad, and we had several people that would call in from India. So it was very fun. So the radio part of it, though, was a little difficult timing-wise and getting things together for it. It was early in the morning. So we're now shifting to this podcast format, but the idea is the same. You won't be able to talk to us personally or talk to me personally while I'm on the air, but we really want you to send in any questions that you have about any topic about medicine, health, healing, coaching, being happy, whatever you want to send in, and then I will speak about it on the air. So you get a little free, not really medical advice, because I can't give you advice without seeing you, but I can give you some general information at very low cost. So, Catherine, what kinds of questions have we gotten either from people that are listening or from our patients?
Well, the first question I'd like to address is one that we've actually been getting quite a few of our patients asking regarding themselves or their friends, and that is that they had to experience COVID and they got through it okay, but they're still having lingering symptoms. They're kind of still tired, or taste isn't coming back, or they just don't feel normal again. And also those who've had COVID, but they're just kind of concerned with everything they've read that it may still be a concern for them. What are some things that they should look out for?
Well, that's a brilliant question for a variety of reasons. And it really pleases me, makes me happy that people are asking those questions, because there really is very little information. You know, you and I both scour information from early in the morning till late at night, looking at ideas and topics to help treat our patients, and some just because we're curious. And as I look at the COVID information, the things that are shockingly to me missing are what can you do to help prevent getting severe COVID, and there is a whole list of things, which I'm actually not going to go into that today a lot, because it's actually very dangerous. A lot of doctors are losing their licenses about talking about anything other than the explicit mainstream treatments that people are talking about. So I'm not going to talk about how to prevent it, other than to say, build up your immune system. So anything that builds your immune system in general should be helpful. And there are tons of studies on things that have been proven to be very, very helpful. Now, one thing I will mention, because this has been shown in numerous studies, is vitamin D. And I think that's pretty well known as probably the number one immune supporter that we have available to us, either from the sun or by taking. And I'm happy to mention this because this is actually appearing in some of the mainstream literature. And the results are, to me, unequivocal. There's about a 25-to-1 ratio between people that are taking high or that have high levels of serum vitamin D versus people with very low levels. The infection rate seems, in terms of symptomatic infection rate, seems to be about 25 times higher in the low vitamin D group. Hospitalizations are about 25 times higher. And a study out of a hospital in Spain recently of people that tested positive for COVID, who came to the hospital thinking they had COVID, they had symptoms, tested positive. They took 76 consecutive patients. They gave some vitamin D, actually relatively moderate doses in my mind for that type of condition, about 25,000 units.
Wow.
And then the other group didn't get any. The group that got the vitamin D 2% went on to need hospitalization. Wow. And so this is after they've been infected. And this is something I wasn't clear about until this study came out. And the ones that did not get the vitamin D, 50% needed hospitalization. That's so once
crazy.
Again, we're seeing that 25-to-1 ratio.
Right.
And so that's appearing in a lot of literature. I'm okay talking about that. I'm not advocating that anybody take vitamin D because there are very, very few people for whom vitamin D supplementation can actually be dangerous.
It's true.
Not very many, but there are enough that I'm not going to broadly recommend it without seeing somebody and doing testing. Actually, you can test and find out quite clearly who or for whom vitamin D could be a problem. Yeah. So, but to get back to your question, one of the things that's been important to me for many years is the information that we have about seasonal flu. And not COVID, but seasonal flu. Right. And so with seasonal influenza, very, very few people die of the virus itself, of influenza. Yeah, it's not a big killer. Most of the people that get recorded as dying from influenza actually die of secondary infections of pneumonia, right? It can be bacterial or viral, but they die of pneumonia, which actually isn't directly the flu itself. But they don't even actually track influenza cases from year to year. They track pneumonia deaths and use that as a surrogate number for influenza deaths.
Wow.
Yeah. But what's really critical to understand is that's just the tip of the iceberg. The majority of people that die from influenza die within 6 months after having influenza, and most think they have a complete recovery, and then they die of heart attacks and stroke.
Wow.
Because the damage from the virus is so significant to the arteries and to the heart that it's the incidence of stroke and heart attack skyrockets. And so the most important thing, treat the virus, do whatever you're going to do, treat the pneumonia, ideally don't get to the pneumonia stage, but most importantly is once you think you're in the clear, then you need to make sure that all of that inflammation is out of your system. Okay. So that then brings us to COVID. And we're looking at, there was a study, I think it was New England Journal of Medicine, published a study. And what they said is that post-COVID strokes were 7 times more likely than strokes were in the general population.
Wow, that's scary.
So these are people that were cleared, right? They had COVID, they got over it, the doctor said, you're fine, go home. 7 times more people then died of a stroke or heart attack. Wow. So that's a really chilling number to me. And so while we see a lot of really inaccurate numbers about COVID, in many different ways. That's one that's actually one of the few that's actually underreported, right? I believe the number is if people die within 60 days after a COVID diagnosis, no matter what they die of, COVID goes on their birth certificate as one of the comorbidities, right?
Death certificate.
Yeah, even if they die of an automobile accident.
Right.
Well, it looks, those I would disagree with, but I think if they have a heart attack or stroke within 6 months, that might go down as a COVID casualty. So again, it'll take a while to parse all of this out and get the numbers straightened out. But for my patients and for those of you listening, this is a really important number.
Definitely.
Now, in China, when patients come in with a possible COVID diagnosis, the first thing they do is test for inflammatory markers, particularly inflammatory markers that affect the heart, to see if this person has a high likelihood of developing heart symptoms. Okay. And so that is done in some hospitals here, but not in all of them. But the thing that should be done also on top of that is there should be a post-COVID testing routinely done. And there are a variety of tests that can be done that can point out the people that are at high risk, and they are not expensive tests. We're looking at under $100, and it could make a huge, huge difference. Now, ideally, when someone is discharged, and they go then for a follow-up to see their medical doctor. Ideally, the doctor does an EKG, right? Yes. Electrocardiogram. We don't do that, so that's not something I have available, but I would like their MD to do that, just to make sure there are no cardiac anomalies that show up. Now, things that we do order for our patients, and I believe doctors should order for their patients also, there are probably 20 tests that are valuable. I'm only going to mention a few of the most important.
Okay.
And to me, by far the most important is high sensitivity C-reactive protein, sometimes called cardiac C-reactive protein. And so this is a reactant that responds to inflammation in the body. So there's a test just called C-reactive protein, which measures general body inflammation. I think that's a good test to run. More importantly is the high sensitivity CRP, which is going to give us an idea about inflammation in the heart and in the arteries specifically.
Oh, wow.
And I do these tests quite routinely on many of my patients with inflammatory problems, and we'll find patients that are off the charts high with C-reactive protein, which means they're a prime candidate for a heart attack. Much more important numbers than, for example, cholesterol, which has some validity, but really is a long-term measure. C-reactive protein is a short-term measure. If you're elevated, you're at risk today. And so that's, to me, is a no-brainer. Everybody should get a high-sensitivity C-reactive protein. Also, I like them to get a homocysteine test. Homocysteine becomes elevated with inflammation, but also when the body is low on several B vitamins, particularly folate, B12, and somewhat B6. And all of those vitamins are dramatically used up when one has a viral infection. In fact, it's one of the major causes of long-term fatigue. Those vitamins are all necessary for cellular energy production, right down to the mitochondrial level. The mitochondria, the little energy factories in the cell, all of your energy basically comes from those mitochondria. There are up to 10,000 in some cells. And so the effectiveness of those is what gives you energy or doesn't give you energy. And if you don't have those B vitamins, you cannot make the energy that you need to run your body. So, which then A, makes you fatigued, but B, keeps your inflammation higher, and C, makes you more vulnerable to future infection.
Oh, that's horrible.
Yeah, exactly. Very inexpensive test. And one of the reasons I like homocysteine is it is a marker for future dementia. People with high homocysteine levels are much more likely to develop future dementia. And part of that is because people with viral infections, retroviruses, and herpes viruses, etc., there's a clear statistical increase in dementia amongst those people. And so doing the homocysteine test can give us a little clue pretty quickly and can lead us to really simple, extremely inexpensive treatment protocols. I'm talking pennies a day to restore those vitamins and reduce homocysteine levels. So those are the two biggies. I would also do a hemoglobin A1C, which is a long-term measure of blood sugar levels. And often the virus can attack anything, right? It attacks, we think about it, the lungs certainly, but the biggest killer is cardiovascular. It also attacks the GI tract very strongly. It attacks the brain. It can attack any tissue. And so we will see diabetics suffering from COVID worse than other people. And also you can start getting changes in the pancreas that can lead to future diabetes. So I would run a hemoglobin A1C, again, a very inexpensive test, a good test to do every year anyway, just to see where you're at, right? Couple of other things. I would run a fibrinogen test and a few others. But those are the biggies, and really need to get your doctor or someone, your chiropractor, your acupuncturist, whoever does your testing for you, to do those simple tests. Now, here's the magic part, and it's kind of like cheating, so don't tell everybody, is you and I do traditional Chinese medicine.
Right.
And so our diagnostics are quite different. Now, you and I work together, and when I'm doing new intakes on patients, I take them through a complete Western evaluation, palpation and looking at a variety of things, blood pressure, pulse oxygen, etc. But we do a traditional Chinese medical evaluation, which in many ways is far more thorough.
True.
Yeah. So, for example, with post-COVID patients, one of the key things to look at is their tongue.
Yeah.
And we've had patients
they've mailed us
who
their tongue.
mailed us pictures of their tongue, and when you see the tongue, it tells you exactly what herbal formulas could or should be effective against the problem, because it all shows up on the tongue. You'll see these deep red spots on the tongue, which are signs of latent inflammation and infection. You'll get changes in tongue coating, which tell you about compromised immune function in the gut. We'll see the shape of the tongue changes. You'll see a pale tongue telling you there's blood deficiency or anemia. But then the real key with COVID are the sublingual veins, the two big veins underneath the tongue. And those, they say the eyes are the windows to the soul, right? Well, those veins are the windows into the cardiovascular system. That's where the veins come up to the surface enough that you can evaluate what's happening in the cardiovascular system. So I'll have patients that I'll see, they'll have sticky, sludgy blood as evidenced by purple, engorged sublingual veins. And I'll recommend dietary changes and herbs and exercise. And the next time they come in, I'll say, how's your exercise going? They go, oh, pretty good. Let me see your tongue. Yes, stop lying to me. You're not exercising, right? Because it'll show up immediately.
Yeah.
And so with illnesses like COVID, the tongue diagnosis is extremely important and very clear. It's very clear for post-COVID conditions.
Right.
Now, of course, we also do very thorough pulse examinations, and what that involves is way beyond our time here. It basically takes about 10,000 pulses before one's qualified to really do a good pulse diagnosis. But in general, we're checking several different positions, basically 9, on the radial artery on each wrist, and there are 27 to 28, depending on how you break them down, different potential pulse qualities. So if you have 28 different qualities in each pulse, and you have 9 on each side for 18, the possibilities get pretty extreme, right? And so being able to interpolate and interpret all of those pulse categories is a work of skill and a work of art. It really takes a lot of training to do that. But that can also show inflammation in the system. It'll show whether your blood flow is working properly. It'll tell us the state of your immune function. And so that is an additional thing that we can do. And then, of course, I'll look at patients' hands. And although this is primarily a Western observation, I find it's not often done in Western clinics. In fact, I'm 69 years old. I've had cardiac problems, and no doctor's ever done any of these things to me, right? And so just very simple things. When I have a new patient, there are about 8 different signs that I'll look for on their hands to tell me about different cardiovascular problems. For example, one can get an infection with COVID, an infection in the pericardium or the sac around the heart called pericarditis. Or they can get an infection in the actual heart tissues, which is in one type is called endocarditis. And by looking at the hands and somewhat the feet, you can get clues. It's not absolute, right? But if I suspected it, I have many times sent patients to their doctors to do more thorough workups. But there are a couple of things that show up on the palms of the hands, something called Osler's nodes, and something called Janeway lesions that will show up with pericarditis and endocarditis. And if you know what they're looking for, they're very clear. And anybody listening, just for the heck of it, go look these up on your favorite lookup. Look it on Wikipedia if you want. Wikipedia is very inaccurate about medical things, but they're good enough for this. Right? So you'll see pictures of Janeway lesions, and Osler's nodes, but also then look for splinter hemorrhages. And splinter hemorrhages I will find far more often than any of these other problems. And splinter hemorrhages, in fact, look at your fingernails, look like little splinters. It's like you've gotten a splinter underneath your fingernail.
Wow.
Right? And it looks for all the world like a splinter. Might be a splinter, right?
Right.
But it also might be a blood clot. And so in a variety of conditions, including heart infections, cancers, etc., the body will throw out tiny, tiny blood clots that get lodged in these tiny blood vessels underneath the fingertips in the nail beds. Now, that's not bad. That's, you're not going to die from that. But if you're throwing small hemorrhages, small blood clots, you also might be throwing larger blood clots that could get lodged in your brain and cause a stroke or cause a heart attack. So
horrible.
Just these really simple things that can be looked at and very simple testing that can be done. But I recommend anyone who either has had COVID, thinks they could have been exposed to COVID. Again, most COVID is asymptomatic.
Right.
Or if you're just generally fatigued and have been, I would say go in and see someone who does these tests, looks for these things, and then treats them. There are many ways to clear up sludgy blood, and you do not want to have sludgy blood that's not moving properly for a lot of reasons. One, you're not getting oxygen to your tissues. Two, you're not carrying waste products away. And three, you have a greater tendency to clot. Okay? So anyway, thank you. That's a great question about COVID and post-COVID.
Lots of information there. So the next question that we've been seeing, we had a patient recently come in with their lab work. Their doctor said that it was completely fine. There was no problems with the lab work, and so they showed it to us, where we were actually able to point out 5 different types of anemia.
Right.
What's going on with that?
And it's important to note, I'm going to talk a little, now on our website, there's a video of me talking about functional medicine. So I would recommend that anyone interested in the podcast, go ahead and take a look at that, because I'll go into a little more detail. Bottom line is, about 30 years or so ago, a group of very bright medical doctors and PhD researchers got together and said, hey, these values that labs are calling standard ranges, there are 2 big problems. One, they're not standard. In most of these cases, the labs make up their own values, right, about what's normal or not normal. And 2, these values were put down many decades ago, and most of them have never been changed, and they're wrong. They're flat out wrong in that they were designed to select people. If you were out of that range, it meant that you needed immediate medical care or an intervention.
Okay.
Now, that's okay. If you're in an emergency room and you run a panel on somebody, okay, what's going to kill them in the next couple days?
Right.
Awesome. I love that. That's great. I look at those values when I look at someone's tests, but what the functional medical doctors did is they said, okay, let's look at some cases. And I believe, don't quote me on this, I think they looked at something like 10,000 cases.
Okay.
And they looked over time at blood tests. Just typical general blood tests that most doctors would order, although a fairly complete blood test. And they found that the ranges were hideously bad. For example, if you look at white blood cell count, which is an indicator of inflammation or primarily of infection. And so if someone is outside of what you see on most tests where they call it normal range or standard range, then you've got a raging infection and you need to do something, probably antibiotics. That's right, thanks. You can tell my bias, right? And so maybe antibiotics. However, women that are in the upper quartile of that normal range, right? So they're still in normal range. They're never out of a normal range, but they're in the upper quartile of that, die of heart attacks at twice the rate over the next 10 years. Now, you and I would not call that normal.
No.
We don't want our patients to have twice the heart attack risk and being told that they're normal.
Right.
So you need to do a little detective work then and find out what the problem is and fix it so you reduce the risk. And some of the labs are much more dramatic than that. If you're looking at the upper range of what's called normal, you could have 4 to 5 times higher mortality rate over the 10-year period versus being in a perfect range.
Right.
Okay? And so that gets me back to the question. And I know the patient you're talking about. After her second child, she's fairly young. After her second child, she's had horrific anxiety and a whole range of other problems.
Oh, wow.
Well, one of the things that will trigger anxiety almost 100% of the time is anemia. Now you'll have extreme fatigue from iron deficiency. Now there are about 200 types of anemia, but the two most common in the U.S. are iron deficiency anemia, which is called microcytic because the cells are micro, they're too small, right? Or macrocytic, meaning large, or sometimes megaloblastic, which is usually a B12 and or folate deficiency. So those are the two biggies. And doctors very rarely look for macrocytic. I mean, you have to be so far off the charts that you're near death before they see that. Yeah. But microcytic, they're a little more hip to. And so when I looked at her labs, and you mentioned there were 5 measures of anemia.
Right.
Those were not functional measures. Those were standard ranges where it kicked out a red flag.
Oh.
Yeah. So these aren't just my opinions.
Right.
This is the medical establishment's opinion that this woman has 5 different kinds of anemia, including a phenomenally low ferritin level. She had a low hemoglobin level. That's a clear, she doesn't have enough hemoglobin. She's not carrying oxygen to her blood. That's a really clear marker of anemia. She had anemia by that marker. She had an extremely low ferritin level. That's another very clear marker of anemia. And so when you have anemia, and I find this particularly with low ferritin, you see a lot of anxiety. 80% to 90% of the children that I've treated for attention deficits problems, I've treated by increasing their iron levels and their ferritin levels. They then got more oxygen to their brain, and they were functional kids.
Wow.
Right, that's it. That's all I did. You get a lot of kids that are very picky eaters, and their iron levels were low.
Yeah.
Great. So that was all it took in many of those cases. So I'm going to do a whole series of podcasts looking at what I consider to be functional lab values for these tests.
Oh, that'd be great.
I also have a book that I'll be coming out with in a few months so that people can, it's not to self-diagnose, it's so that you can look at your own tests and say, hey, there's something wrong here, and then find a practitioner who will actually look at it with you rather than shining it on. And some of these values are, it's stunning. It's stunning. And you've been with me when I've had patients come in. So there's a test for triglycerides. Okay. And triglycerides are floating blood fats. And high triglycerides mean you have too many floating blood fats, but also it's an early warning sign, or a late warning sign in many cases, of diabetes. Because when the body won't accept the sugar into the cells, when the insulin can't take all the sugar and put it into the cells, insulin then packages it for storage because the body doesn't waste anything, right? And that storage form of sugar is then a fat called a triglyceride. Okay. And generally that fat goes right on your belly. Not your belly, but on one's belly, right? And so it's very, very unhealthy to have high triglyceride levels. Well, if you go to many labs, we use LabCorp a lot, so I'll talk about them. They want triglycerides under 150. Okay. In a functional medicine look at this, the values, we generally want it under 100. Okay? There's one major HMO in my area where it says that your triglycerides are normal if they're under 839. Now, that's more than 8 times what I would consider normal. Yeah. That person's, if they're at 800, their blood is practically fat,
horrible.
right? It's horrible. So again, looking at these values is important. And I'm going to throw out a couple of values. I don't usually do this, but these are functional values. I have many different functional values from different sources, but these are from one of my favorite sources. And one that's really grossly underused is because it's grossly misunderstood, is a test called MCV. MCV is mean corpuscular volume. And the corpuscle they're talking about here is the red blood cell. So it's the average or mean size of a red blood cells in your system. Okay. And there's a range for those. Now, some labs will say the normal range is 79 to 100. That's obscene.
That's a big
That's
range.
an obscenity,
That's
actually.
a really big range.
I have never, in my tens of thousands of patients I've seen, my decades in practice, I have never once seen a single patient who had an MCV of 85 or under who didn't have gross signs of anemia. And by gross, I mean I could look at them.
Right.
I could do a
Pale.
simple exam, look at their tongue, their eyelids, their nail beds, etc., and tell them that in Chinese medicine they had a blood deficiency,
Right.
which in their case equaled anemia.
Right.
And so to me, 79 to 100, and this is where the problem comes in. I've had many kids come in with MCV around 80, and their doctor says you're fine. In fact, there's one kid was a star baseball player. In fact, his coaches felt he had major league potential, but he totally fell off the wagon. He couldn't concentrate. He wasn't even starting on his baseball team anymore. He was failing his classes, and I treated his mom, and she sent me his labs. I said, "Well, your kid's anemic." And she said, "My doctor said he's fine." I said, "Okay, whatever." But with an MCV of 80, he's not getting oxygen to his brain. Enough.
Right.
He's getting some, obviously. He's alive.
Yeah.
He's not getting enough oxygen to his brain. We treated him for that. He's now playing baseball or he was before COVID, on traveling baseball teams literally all over the country. That's all it took was getting his iron levels up.
Wow.
And the problem was they're not looking at the right values.
Yeah.
So they'll say up to 100. LabCorp now says up to 97 is normal. In most functional medicine books or lectures, etc., the range is usually 84 to 90. I'm not too concerned if it gets up to 91. If it's over 91, there's a B12 and or folate deficiency almost for sure.
Okay.
If it gets over 95, there's almost certainly 3 to 4 genetic breakdowns where they can't methylate folate. And so these are the MTHFR things that we hear so much about.
Right.
But they can't utilize the folate. They're getting it into their system. Doesn't matter how much they get in because it's not going to the right form.
Right.
If it's over 100, I suspect alcoholism because that's one of the things that will really drive down B vitamin levels. And if it's not alcohol consumption, then they are probably across the board unable to process folate and B12 or cobalamin into the methyl forms that the body needs to utilize. And so that test alone is like worth, it's crazy how much information. And that brings me to the other problem. When tests are looked, and I don't want to put anybody down. I mean, people do what they do, and they all mean well, and they have different amounts of time. Like I have the great privilege of spending lots of time with my patients, and I can go into their labs at great detail. And if you're looking at a lot of HMO systems, the doctors just don't have that time. Right. It's not the doctor, it's the system, right? So, but one of the issues is I will see people analyze labs as though each thing is a separate entity unto itself. Now, on one level, that's true, right? But when you look at the matrix, then you start to see all these anomalies. For example, in the patient we were talking about, now she was grossly out of range, grossly because it showed up as a red flag. But even if she didn't, even if she were borderline, at 6 of those, she's going to have anemia symptoms. And so often that doesn't get looked at, right? It's like she's got a little bit low red blood cell count, meaning she doesn't have enough red blood cells. The cells are a little bit small. the cells don't have enough hemoglobin, but just a little bit, right? And you start looking at all these factors and adding them up, and it's going to show up in the person's body as anemia, right? So looking at this as a totality, as a matrix, is really, really critical. And not just blood tests, but all of these things, right? If you look at chemistry panels and you get a calcium test that's out of range, you have to look at the albumin, because the albumin carries the calcium, right? If the albumin's high, calcium's going to be high. So you need to look at these things as a matrix. And so I'm going to throw out a couple values here. Again, the mean corpuscular volume, we want 84 to 90. Hemoglobin, which many labs have, values in the 10 to 12 range being still normal. I want that at least 13 in men and women, and quite a bit over that in men generally. Red blood cell count, which varies tremendously from lab to lab. Some will say you should be over 4.2. Some labs say you only need over 3.6. That's a big range,
that is a really
right?
big range.
Well, I want it over 4.3 in women. And, again, because they're menstruating. These are menstruating women. So they're losing some blood, so you figure they're going to have a little bit lower red blood cell count. Plus, they don't make quite as much, but that's for another topic or another day. Men, I want it at 4.8 or higher, because they're not losing blood. Right? White blood cell count in most labs, and there's a huge variation here too. You'll see a high end of 12.5. Some will have a high end of 10.5, etc. I want it under 6. I don't want it too low. I don't want it under 3.5, because that could be pointing toward a leukemia issue or something. But I don't want it over 6. If it's over 6, something bad is happening. Right? Maybe it's an infected tooth that you don't know you have. Maybe it's some occult infection somewhere else in your body. Maybe you're forming a cyst and you don't know. But when the white cell count gets over 6, you really need to check it out. Ferritin, which is a measure of iron storage, and in many ways it's one of the two most accurate ways to diagnose iron deficiency anemia, because it's a storage form, where an iron test tells you what's in the blood, but it doesn't tell you if you're able to store it. And they both have value. I do both, but ferritin I look at a little bit more for anemias. And many labs, again, the bottom range is all over the place. But there were studies done in France almost 30 years ago already showing that over 90% of children with ADHD had ferritin levels of 35 or less. Now, most labs will say anything over 25 is fine. Some even go lower than that. I want ferritin levels in women at 50 or more and men at 75. Now, there's an upper limit, too, because ferritin will go up when there are infections and cancers, etc. So there's a range, right? In women, I want 50 to 125. In women, And in men, I want 75 to 150. And so if it's outside of that range, I'm going to look to see what's going on and find the problem. And then platelets, which are often dismissed. Platelets are clotting factors. And if you have too many platelets, it means you have inflammation or some other huge problem, and I find that grossly overlooked. And I want platelet values between 225 and 275, and a lot of labs will say up around 350 to 400 is okay. But when you get up in that range, you got a lot of clotting and inflammation occurring. So anyway, back to our patient. The key is, if you have anything that shows up as a red flag, bug your doctor. If it's a red flag, it means in their system, you got a problem.
You do.
Right? And then if you're not sure, go back and listen to these values that I gave you. And if you're outside of those values, then you should see a functional medical doctor or someone that does functional medicine like you or I, or somebody that can get down and really diagnose. Because again, these generally aren't things that are going to kill you today. But 5 years down the line, you're going to have ill health. 10 years down the line, you may be dead. And so we want our patients. I'm greedy. I want my patients for life. Right?
So definitely prevent that.
Cool. All right. Did that help on the iron? A general caveat. High iron levels are extremely dangerous.
Really?
Yeah. Iron rusts. If you leave
That's
a
true.
nail outside, well, not so much the new ones, but the older nails, they rust. If you leave a
Right.
piece of iron outside, it rusts. That's oxidation, right? That's an oxidative reaction. Oxidative reactions in the body are inflammatory reactions and cause huge damage. So if iron levels, and ferritin is actually a molecule that protects you from the damage that iron can do, right?
Okay.
And so if iron is too high, you can then get too much of an oxidative reaction and you get too much inflammation. So in my practice, I'm almost always trying to push up the values in kids and push up the values in menstruating women.
Right.
And I'm constantly trying to push down the values in men and push down the values in menopausal women who are not losing that blood. And it's huge. I mean, there's a huge correlation between cardiovascular disease, stroke, even MS, and iron levels.
Wow.
And so very deadly to have them too high. Now, in terms of iron, if you want to increase your iron levels, the best way is to eat meat. Spinach, for example, it's almost impossible to pull the iron out because it's a form of iron that you have to have an extremely acidic stomach. It has to be down between 1 and 2
so rare.
pH, which is really rare.
Yeah.
Heme iron from meat, you can be 3 to 4, which is, acidic, but not that acidic. And so particularly in older people where the stomach acid gets much weaker, then meat may be the only way that they can really absorb the iron.
That makes sense.
Iron pills can be a little dangerous because that's usually, you can get others, but usually it's ferrous sulfate, which is an iron that you're ingesting. It's like ground up nails.
Ew.
Yeah, not a good plan. So it's much better to get it up naturally. So I'm trying to get kids to eat a little more meat.
Right.
I have actually moms hide little bits of liver in their hamburger because liver is really, really high in iron and not something that Americans eat much of.
No.
And so I'll have mom put little bits in the hamburger, and you can just see the kids' iron levels shoot up, and you can see their mood improve. You see them do better in school. The ADD kind of will start to disintegrate, basically. And also with my female patients, if they're vegetarians, then we have to go to pretty great lengths to get other forms of iron into them, some form of vegetable iron. But if you eat or drink an acidic substance around or just before you ingest whatever the iron matrix is, whether it's a heme iron from meat or a vegetable iron, that it will pull the iron out more effectively, the acidity, right? So kids...
Is that why you recommend apple cider vinegar?
It is. It's a brilliant thing. And apple cider vinegar, we'll do a whole show on sometime, some of the new research about why it's so amazingly effective. We've known it works, but now it's like, whoa, whole new avenues in research. But yeah, some acidic medium. And so like for kids, I want them to have some orange juice and some bacon or whatever, right, for breakfast. For men, stay away from the orange juice, stay away from the bacon, right? Maybe a tiny amount of bacon to kind of season things, but not a lot because you don't want that iron overload. And don't do anything acidic. That includes coffee, apple cider vinegar, lemon juice, orange juice, etc. Don't do any of those things with a meal where you're consuming meat. Okay?
Good advice.
Yeah, exactly. And
really
simple,
good
right?
Advice. Yes.
Cool. So I think that handles that topic. Anything else we should cover today?
Yeah, we had a patient coming in with an interesting question. They were concerned. They were dealing with asthma, and their doctor wanted them to be on steroids, but they were kind of concerned about that. What are your thoughts on?
Well, it's a very, very valid concern. It's been well known that steroids in general lead to more osteoporosis, weakening of the bones, amongst other things. There are lots of ill effects from steroids. Now, once again, steroids are lifesavers. I have many patients who've had their lives saved because they were put on steroids. So I'm not anti-steroid. I'm pro-antibiotics, pro-steroids, as a anti-anxiety medications in some cases, as a short-term fix. Stop the problem. If someone's going to die without steroids, give them steroids. If someone's got a raging infection, give them antibiotics. We'll clean up the mess later, right? But with long-term use, you need to go to the source. You need to go to the problem. What's causing the asthma?
Right.
I mean, asthma doesn't just happen, right? There's a cause. And typically, and there are many different kinds of asthma, but typically we'll break them down into heat-induced, exercise-induced, cold-induced, or a reaction to something in the environment.
Yeah.
So when you really break those down, then it gives you a lot more treatment options other than steroids. Steroid is just a blunt hammer, right? You're just pounding on something. It's not a delicate instrument, right? And so in China, for example, the National Health Service will put out a bulletin to all doctors on what's supposed to be the hottest week of the year. And during that week, they'll have all of their asthma patients come in, particularly kids, with cold-induced asthma. And they'll treat them with herbs on acupuncture points on their back to heat their system so that they don't get the cold asthma when it gets cold. They will also send a bulletin out during the coldest week of the month to treat hot asthma 6 months in advance.
That's so fascinating.
Yeah, by building up whatever needs to be built up around those things. And so the key is to find out specifically what the problem is and then not hit it with a blunt tool, but really go after the specifics.
Right.
Okay. But in terms of the osteoporosis, there was an article recently showing that the patients that received fairly high doses of oral steroids had 4.5 times higher odds of developing osteoporosis and almost a 2 times higher risk with inhaled steroids. Now, we've known, it was pretty clear knowledge that if you take a lot of steroids orally, it's a problem. There was still some denial about inhaled. There's no denial anymore. It's 1.5 to 2 times greater risk of osteoporosis, and osteoporosis is always at a higher risk for women. There's not as much bone mass. So if you have asthma and your doctor isn't treating the asthma, see, steroids aren't treating the asthma.
No.
Steroids are treating a symptom,
right?
So if you're not having the actual asthma treated, go see someone that it will.
Right.
See a chiropractor, see a functional medical doctor. Acupuncture is brilliant for asthma. In fact, there was a study done, and if any of you have asthma, I recommend you look this one up. It was done at Mount Sinai Hospital, and it's a fairly old study. It's easy to find, and it was brilliantly conceived. They took a group of asthma patients, and it was a double-blind study, and they randomly divided them. One group was put on steroids. The other group was put on Chinese herbal formulas.
Okay.
Now, the brilliant thing that they did is before they started the study, they checked the levels of naturally occurring immune functions, corticosteroids in the body, right? Our bodies produce corticosteroids, the adrenal glands, right? And they should put out your fires. When those get weak for whatever reason, like overuse in asthma, then they can't put out the fire, and you take external steroids, right?
Right.
Well, in this case, they tested for those markers of corticosteroids, naturally produced. And they kept people on this, I believe, for 6 weeks, but I could be wrong on the period of time. The incidence of asthma attacks was almost identical in the two groups.
Okay.
One with steroids, one with the herbal remedy. However, they then, again, in a brilliant study, measured those immune factors. And in the herbal group, the natural corticosteroids had just gone through the roof. They were back to almost normal levels, where in the steroid group, they dropped even further. Because when you take external steroids, it will reduce your body's ability to produce steroids.
True.
Right? Because they're feedback loops.
Yeah.
And so this one group had very high corticosteroids, the other had none. So guess what happened over the next 6 months? The ones that had been on steroids needed to go back on steroids. The one on herbs were fine.
Broke the cycle.
They got the body doing what the body needed to do to protect itself rather than being overridden by the externally induced steroids.
That's amazing.
Yeah, and this is a very old study. And so if you're not in a position where for one reason or another you cannot find a physician that's going to properly treat the asthma, looking at the cause of it, at least do everything you can to protect your bones.
Yeah.
Women should never take calcium without taking vitamin K.
Yes.
Men shouldn't either, but with women it's really critical. So you want to go check out the literature. I'm not recommending this for any individual because I don't know you, but what I would look at is low-dose calcium supplementation, very low-dose occasional strontium supplementation, magnesium supplementation, and fairly what I would consider moderate doses, but many people would consider high doses of vitamin D and vitamin K.
Okay.
So vitamin D, I would do a minimum of 5,000 units a day, and vitamin K, I do 180 to 500 micrograms a day. And K is miraculous. So vitamin D, I'm going to be a little inaccurate here, but one of the things it does is let's say it activates your calcium, right?
Gotcha.
It gets it moving, but it doesn't direct it. And so the calcium in women who do vitamin D and calcium have higher heart attack rates because some of that calcium is going to go to their arteries and harden their arteries rather than going to their bones. Now, vitamin K is miraculous in that it does two amazing functions. One, it increases osteocalcin levels, which attract and calcitonin, there's a whole thing that goes on there. But so it attracts the calcium to go into your bones and your teeth. In fact, there are dentists that basically their primary treatment methods are vitamin K and vitamin D, right?
Really?
Yeah. And so vitamin K will direct it to your bones and teeth, and more importantly, maybe, it activates another hormone called matrix GLA protein, which pulls the calcium out of your heart and your soft tissues. And so it's doing both of these miraculous things at the same time. So if you have to stay on your steroids, or if you've been on steroids historically, again, a little bit of calcium, not a lot, some magnesium, a tiny amount of strontium, vitamin K and vitamin D are some ways to help rebuild your bones.
Sounds like a good plan.
Cool. I think that's about all people. Oh, there's one other thing I want to mention. This is kind of going back. I forgot with the COVID.
Oh, okay.
Hospitals in China, they've been doing massive amounts of testing, and they find that both during COVID attacks and post-COVID, there's a huge shift in the microbiome. So the bacterial levels and the types of bacteria in the gut.
Okay.
And what they find is because of that shift, there's much more residual inflammation. And so as we know probiotics are good for so many other things, they may be one of the more critical factors in a full recovery from COVID. Now, what we don't know, I haven't seen any literature, is whether different microbiome levels might be somewhat preventive or maybe can mediate the severity of the disease. I have not seen those.
Right.
But we do know now quite conclusively from this Chinese study that it does mess up your microbiome levels in a way that leave you vulnerable.
Load up on those probiotics.
Yeah, go for it. Okay, this is John Nieters, Doctor of Acupuncture and Oriental Medicine, and I'm here with the marvelous Catherine Black, acupuncturist, and we're happy to spend an hour or so with you. Thank you. Bye-bye.
Thank you.